Why is bone mineral density important in the FRAX tool? Imagine trying to predict how likely someone is to break a bone in the next 10 years. The FRAX tool helps do just that by combining different pieces of information. One of the most important pieces is bone mineral density, or BMD. BMD is a measurement of how much mineral content is in your bones, usually taken at the hip using a special scan called dual energy X-ray absorptiometry. This scan gives a number that tells us how strong your bones are. The higher the BMD, the stronger your bones tend to be, and the lower your risk of breaking a bone. Conversely, a lower BMD indicates weaker bones and a higher chance of fractures. Including BMD in the FRAX calculation makes the risk estimate much more accurate. While the tool also considers factors like age, sex, history of previous fractures, smoking, use of certain medications, and health conditions like rheumatoid arthritis, adding the BMD measurement gives an objective view of bone strength. This helps doctors better understand who is truly at risk. Without BMD, the FRAX tool can still give an estimate based on clinical factors alone, but it is less precise. When BMD is included, the prediction of fractures over the next 10 years becomes more reliable, especially for serious fractures like those of the hip or spine. Bone mineral density measured by dual energy X-ray absorptiometry is considered the gold standard for diagnosing osteoporosis and assessing fracture risk. It can detect bone loss before any fractures happen and correlates well with actual fracture outcomes. While BMD is a key indicator, it is important to remember that bone strength also depends on other factors like bone quality and microarchitecture, which are not measured by BMD scans. Still, BMD remains the most standardized and widely used way to quantify bone health and guide treatment decisions. Using BMD in the FRAX tool helps clinicians identify people who might benefit from medications or lifestyle changes to strengthen their bones. It also helps differentiate between patients with similar risk factors but different bone densities, leading to more personalized care. Additionally, measuring BMD over time can show whether treatments are working by increasing bone density. Overall, BMD adds a crucial piece to the puzzle, making fracture risk assessments more accurate and helping doctors make better informed choices to protect bone health. Remember, always consult a healthcare professional for personalized advice and to interpret your BMD results in the context of your overall health.